Even though I'm a licensed clinical professional counselor, I consider myself to be a teacher and a coach more than a psychotherapist, which sounds so mysterious and complicated. In fact, therapy is not so complicated because it mostly involves teaching self-care skills. And the most important skills I teach are cognitive behavioral techniques and mindfulness, which are highly effective in decreasing depression, anxiety, and other symptoms. Cognitive behavioral techniques, also called CBT, and mindfulness are learned skills, well suited to being taught online and by phone. But they require practice, which is why good coaching is important. In this video, I will explain what CBT and mindfulness are, their differences, and how they actually work together nicely as part of one's toolkit for good mental health. Most anxiety and depression are fueled by our own thinking. Learning CBT and mindfulness enables us to tame our mind for improved emotional regulation, decreased stress, and improved self-care. However, they go about taming the mind in slightly different ways. CBT is based on the premise that our emotional upsets are caused by the erroneous stories and beliefs that we tell ourselves about our situations in life. So if you want to change the way you feel, you must change the story you tell yourself, which means replacing distorted stories with accurate ones. For example, if I make a mistake at work and then react by telling myself that I'm a failure who will never amount to anything, I will probably become depressed. However, if I tell myself that no one is perfect and making a mistake doesn't make me a bad person, and the best thing I can do is learn from my mistakes, then I may be disappointed, but I won't be depressed. So in summary, CBT is about learning to recognize the automatic erroneous thoughts and beliefs that fuel anxiety and depression, and then replacing them with more accurate and realistic thoughts that allow me to remain grounded so I can handle stressful situations more effectively. In other words, I learn to change mistaken beliefs into realistic ones, which is vital for good mental health. Mindfulness, on the other hand, is more than just changing the self-talk. Rather, it involves changing my relationship to all the erroneous automatic stories and beliefs that emanate from my lower brain. I do this by learning to recognize the stinking thinking that automatically gets triggered in times of stress. For example, I make a mistake and my lower brain immediately starts condemning me. So rather than argue with this one story or belief, I simply recognize it as stinking thinking and detach from it by reminding myself these thoughts are not true or reality, but just what my mind does under stress. So I can choose to let go of them and instead return my attention to the present moment. So mindfulness is the practice of recognizing and learning to not focus on any of the erroneous thoughts and beliefs that fuel my depression and anxiety. I may not be able to stop them from popping up, but I can choose to not get sucked into them. In summary, CBT involves replacing each erroneous thought with a realistic one, while mindfulness involves detaching from all erroneous thoughts without necessarily trying to argue with any of them. Instead, I remind myself that this is just what my mind does and it's not helpful, so I can choose to ignore them and bring my focus back to the present moment. In practice, CBT and mindfulness go hand in hand, two different ways of achieving the same goal of taming the mind. If you found this video helpful, please click the thumbs up button. And if you want to hear more from me, then subscribe to my channel, Counselor Carl. I will be publishing a new video every other weekend. And if you'd like help in learning CBT or mindfulness, then visit my website, SerenityOnlineTherapy.com, where you can read more about me and the services I provide. And finally, keep paying attention to your life. Until next time.